Coming up this week, should there be a referendum on electoral reform? Also, what are your concerns about an assisted dying law? This and much more to come. Hitting the streets, this is Outburst. Hello and welcome to Outburst. I'm Glenn McGuinness. Well, during last year's federal election, the Trudeau Liberals promised it would be the last one fought under the current first-past-the-post system. But Conservatives in both the House and the Senate are opposed to any drastic changes to the electoral system without first taking the question to the people through a referendum. So we sent our cameras out to see what you think. Our question: should there be a referendum on electoral reform?
No.
Why?
Because I think this issue has been supported by at least three parties in the election, and we have a system where we delegate responsibility for important decisions to members of Parliament.
Okay, ma'am, anything to add?
So, nothing really to add except for the fact I think the question would be so complex that people would get all confused. Remember the question in Quebec. It seemed like a simple question. People weren't sure if they were supposed to say yes or no. So let's not confuse the electorate. They've elected a parliament. Let them do their job.
It's hard enough getting people out to vote, so I don't know that that's really going to be a fair representation of what they want. But
Okay, what do you think?
Yeah, I think there needs to be more education to the public, because I don't know if the public is really aware of like what first past the post means and what proportional representation would mean. So I think if we are going to have a referendum, there needs to be people need to be more aware of what the differences are and what the impact is going to be.
Absolutely, yes.
Why?
Because I personally think I don't want to say like or agree with the way it's happening right now, but I would absolutely at least like to see people's opinions on changing it.
Okay,
yeah.
Sure, sir.
Actually, what she said, I completely agree.
You think the people?
The people should at least have a say.
Just
Just
be
at least,
interesting to see what the opinion is.
right.
Yeah, I think there probably should. Yeah. I mean, I think that when you change the rules of the game kind of determine who ends up winning the game. And it's just such a big issue that I feel like it's important that Canadians are consulted widely on that.
I think so. Yeah, sure. Ask her.
I think so because it's a democracy, so we should decide on how it should be run.
It's all about democracy. People should have the right to decide.
So do you agree with a referendum?
In that, yeah, I agree with the referendum. I don't personally enjoy referendums, but I think people need to decide whether they want to go forward one way or another.
No, it should not. There are decisions that it's the government who should take care of those. There are people that have the knowledge, I think. Yeah.
So you think there's people with more information that are making those decisions, and you're okay with that?
I'm okay with that.
Yeah, what about you? Should we have a referendum?
I think we should leave it to the people. Because essentially the whole thing, the whole thing is benefit the people. I thought that's the whole philosophy behind all the decisions we're making. I think so. You think you leave to the people? Yeah.
Yes, I think so.
What?
Because democracy is supposed to be for the people, and the people have equal franchise in Canada in every election, and women, men, everybody. But if a few people on Parliament Hill decide what's going to be the new voting system, then the rest of us are going to be bound by it whether we like it or not. And we're all voting for them too. So I think there should be some kind of a change, yes.
I mean, we do elect our officials to represent us and then to make decisions in Parliament. And then if you have a referendum on everything, then it would just be clogged up with referendums. I think that you have to leave it to the experts, like the people and members of Parliament who we have elected to make decisions for us on our behalf.
Yeah, I think it would be good to consult with Canadians just to see what the opinion of the public is, because after all, we're the ones that elect officials to office, so I think we should have a say on the system and how it works.
Well, I guess in the view that it's one of the most fundamental rights is the right to elect representatives, that the system that we have for it is taken for granted, but it's an established system, and I think it's fundamental that people have a direct vote as opposed to an indirect vote through representatives.
What was former Prime Minister John Diefenbaker's middle name? Fitzgerald, George, or Charles?
Charles.
Charles. Charles. I think it's Charles. Final answer. Charles.
Fitzgerald.
George.
I have no idea.
One of the three.
George.
I like George. I'm going with George.
It's George.
Is it George? Yes. My favorite name, George.
That's my cat's name, too.
I like George.
John George Diefenbaker was Prime Minister of Canada from June 21st, 1957 to April 22nd, 1963. Currently in Canada, there is no legislation governing medically assisted dying since the Liberal government failed to implement changes in time for the Supreme Court's June 6th deadline. The matter of Bill C-14 is now in the hands of the Senate. The Canadian Medical Association says proceeding without proper legislation could be risky. So we took the topic to you. Our question: what are your concerns about an assisted dying law?
The only concern I would have is that if we take advantage of old people who are sick for other circumstances, for other reasons, personal reasons, that greed or whatever, that would lead to an unfortunate demise of these people.
I have that concern also. Plus, I'm a little concerned about the fact that it may push aside the issue of providing better palliative care.
Yeah, I think there's the concern over vulnerable persons. I think also getting the right bill, so I don't know, making sure that it's accomplishing what it's meant to accomplish and there's not going to be abuses and that kind of thing. And because it's such a difficult, complicated topic, to create a bill about it is fairly difficult. Yeah.
Well, there's the religious aspect of it, and then there's also the consent part of it. So is there implied consent? Is there not, in terms of like serious illness and stuff like that? And then, yeah, just the social conscious things for doctors and whether they, how you excuse yourself or not. And I don't know, it is quite complex.
A lot of clarifications needed. Yeah, I don't know.
And then the criteria too. So there are certain ones right now that they're talking about for like imminent death type things where death is anticipated quickly, but I don't know what the real terminology is on that one. But
I think as long as it's done, there's a procedure in place and it's followed absolutely to the letter each and every time, then no, I would have absolutely no concerns with it whatsoever.
Well, I think there are two big issues. One is making sure that the ruling set out by the Supreme Court is actually followed and mirrored in the legislation, and that it's comprehensive enough to capture everybody who has a constitutional right for assisted dying. And then I think the other thing would be safeguards in place for certain vulnerable populations.
I think they should be allowed to do it. I lost my mom when I was 15, and I watched her die after basically being starved to death. She had cancer. She was 36 years old, and it's just not a good thing to see someone suffer that. Yeah, it's awful. And so to be able to have that choice, and it's not just, okay, it's a terminal thing. How long do you have? Is it 6 months? Are you going to suffer for 6 months? Do you have to? It should be up to the people to decide. If it's terminal, then they should be able to go how they want to go.
It is pretty sad if anyone in this world has had a loved one die very slowly, and they do take them off food. It's horrible.
Yeah, you're basically
to
watching
watch
them
starve.
starve to death.
It's very horrible. And I mean, maybe the people
cruel.
are against it. Maybe they haven't seen a loved one die.
No, but we put our animals down when they're suffering. We don't want to watch them suffer. We know they're going. We can bring them in and we say our goodbyes and we let them go. Otherwise, we're watching them suffer. So I think that if we can treat our animals with dignity, we should be able to do that with our loved ones as well.
The only concern I have with the legislation the way it is that it may be that some people suffer or don't have an opportunity to change their mind before the amendments that they are talking about actually go through. So I don't know what's going to happen now that the law isn't in effect, but the old one is expired. There's no new one in its place. So just a worry that things need to be tweaked a little bit in the amendment sense, that won't happen fast enough if they don't get it done soon.
The only concerns I would have would be if someone was incapacitated and hadn't, even though they had made their choices beforehand, like at what point do you then go ahead and make their wishes happen? Like, it's different if you have the mental capacity to do it. The only issue is like with dementia and with Alzheimer's and that. I think that's sort of a gray area, and I think that could be a little bit of a slippery slope.
That's a very tricky question. I'm a little bit on the fence myself on that one because I can see both sides of the coin. If you're faced with that predicament, I think I can understand why you would want to end your suffering. But on the other hand, there's all the cases of abuse out there, or even liability with regards to being in a position like a doctor, for example, having to make that decision. It could put them at risk too. So I can see both sides here.
Slippery slope. I think that it's necessary to have, first of all, I think there should be a law. So better to have a law than no law if it's going to be put into practice or if it's been declared a right. And I think that the issue is that if you don't have a well-crafted law, you're going to have people feeling pushed or feeling like maybe it's their time. And I certainly have seen, I think we all have seen that. And so a concern I have is that it's very tightly regulated and scrutinized by third parties. That is the medical staff, for example, or others that are charged with that responsibility.
Who was the youngest person ever to be sworn in as Prime Minister? Justin Trudeau, Joe Clark, or Stephen Harper?
I feel like this is a trick question, but
this is a trick question too.
Justin Trudeau.
I don't know, because I think Stephen Harper just looks old, and Justin Trudeau just looks young.
What do you think?
Justin Trudeau.
Okay, we'll go with Justin Trudeau.
Justin Trudeau.
That face.
Joe Clark.
Justin Trudeau.
Joe Clark.
Joe Clark.
It is Joe Clark. The Right Honourable Joe Clark became Prime Minister June 4th, 1979, at the age of 39 years, 11 months. Canada's universal healthcare system has been the envy of many countries around the world. But some of the snags we face here in Canada are, of course, long wait times and, in some communities, a doctor shortage. So we sent our cameras out to give you the opportunity to address the issue. Our question: what are your ideas to improve Canada's healthcare system?
We should quit asking for government to do more and more and more and more. The only way out of this business of excessive healthcare spending is for you and I, all of us, to, number one, listen to our doctors, which is to eat less and exercise more. Those are the two actions that we all need to take as Canadians to reduce healthcare spending.
Currently, what we are doing with our low income and our homeless and our poor is unacceptable. And I believe this is causing the biggest stress on our healthcare system. If you knew how much it costs to take people from the DI and shift them back and forth to the hospitals on a current basis, you would understand we need to find a more long-term solution for them, and I think that would cut down on our healthcare system tremendously.
I really can't complain about our healthcare system when I look at what, I've lived overseas, and their healthcare system is very good over there too, very cheap compared to what ours is. But I also have a lot of friends in the United States, and their health system is scary. It's very expensive, and you have to be very careful there. If you do get ill, you can owe hundreds of thousands of dollars. So I don't know. I think our health system is, there's always room for improvement, but
it has to take really different thinking from what we've done. So it's not just address the current issues, it's health issues. It's get out in front of them and try and prevent them. The other thing that's badly broken right now is sort of the walking wounded. So something that is preventing people from having the healthy lifestyle that they would choose, but it's not bad enough that it is, so it could be chronic, but it's not totally debilitating, and the system doesn't work for that at all. So again, it's have to figure out something to open up the space so that can be treated and addressed in a more timely manner.
I've got no complaints about the Canada health system. I had no issues myself, but I think it's just like everything else. As a matter of fact, I was just talking to my doctor the other day. A lot of people go to see the doctor, and they got no reason to go to the doctor because they're bored, and they, it's a social visit more than a medical thing.
I think to improve the healthcare system, we need to get people active and really encourage activity. Let's bring back the tax credits for children's activities especially, and really encourage parents and their children to get out there and move around.
Healthcare system, well, I'll give you an example. Okay, my wife just recently, she had 2 tests done, ordered by the same doctor. So they phoned her to come in for the results. So when she went in to get the results from the doctor, they gave her the one result. She got home 3 days later, they phoned her and said, oh, your other results are in. So they called her to come in for the second set of results. Both of them were normal, but they get to charge the system twice. And I think there's a big waste, total lot of waste in the system. I think there should be a little more accountability in regards to how it's spent.
I think introducing a 2-tier healthcare system, I think there's a lot of countries that run that model already, or like cities that run that model, and I think it helps alleviate a lot of the stress on the ER systems and a lot of the primary healthcare physicians. I think a lot of people are seeking help when they can't really get it, in terms of a long wait for 6 to 10 hours isn't feasible when you need to get to see a doctor right away. And I know there's triaging and all that, but I think those who can afford the healthcare to seek more expensive healthcare in a private healthcare system, I think they should be able to afford that. And those who need the public healthcare system still have access to it.
Retrofit, right from the bottom up. I think how we do things now, whatever, is too compartmentalized in terms of the provinces, in terms of maybe the individual boards. And we need to take a closer look at it from the bottom up and the top down. I think we need to look at it from both perspectives equally.
Well, you got some hard-hitting questions there. Well, I think wellness there's a big focus that should go towards wellness, and I think the medical community and the wellness community have to come together with a more integrative whole to really drum that up, because we don't have the healthcare dollars to sustain the aging population. So I think that you definitely need to be looking at proactive ways of treating healthcare before people kind of get to the disease process in it. So
I think it's good. I've never had a problem with it. Anything I've needed, I've always been able to get, and I don't have to worry about it like they do in the U.S.
I've been really fortunate. I don't use the health system that much, but when I have, I've had no issues with it at all. With wait times, with the times that I've been in hospital with broken bones, it's been pain-free.
A lot of our doctors are going away, right? So we do need more doctors, and I don't know. Probably schooling should be a lot easier for the kids to get into, so they can get into the healthcare business.
True.
Right?
Very true. I agree with that. Yeah, she's right. I think that the seniors are getting shafted, The seniors are having to pay all kinds of extra dollars now. It's gone up again for us, and it's hard for some of the seniors. We don't have good coverage anymore. Like, coverage from work is gone, and I think it should be you know, they should look after the seniors a little better anyways.
You know, with an aging population, we should look for ways to keep everybody healthy, because if you can keep people healthy, then you can prevent them from taxing into the healthcare system.
Historically, Canada has built a fine reputation for itself. After 2 world wars, the Korean War, and our involvement in Afghanistan, Canada has carved out a respectable identity around the world. But just how do other countries view us? Our question. How would you describe Canada's image internationally?
I think we're well looked upon internationally. Anytime I travel, being Canadian's definitely a positive thing. People look upon Canadians positively and as good people, and yeah.
I would say it's generally pretty positive. I mean, we're a fairly inert nation. We don't do too much outside to stir people's pots so much. But, I mean, generally we're relatively good at business, relatively well-rounded overall. And, I mean, in terms of South America, which is where my family's from, Canadians have a good reputation of being polite and embracing of different cultures.
We accept differences, you know, that it's, and that there's a richness in that it's not, you know, the way that what Trump is putting out. We don't want to take that route, right? So that's it. We want more of a hopeful thing, and I think Canada presents more of that kind of image.
Super friendly, relaxed, very accommodating. Australians and Canadians are very similar, hence why I'm now dual citizen. Yeah, just really easygoing, outdoorsy.
Did you have that impression of Canadians before you moved here? What were the thoughts back home that, okay, Canada's like us? What would it...
Yeah, absolutely. I mean, the Commonwealth countries too, right? So, I mean, when I decided to travel Canada in 2000, back in 2000, for about 6 weeks, I loved it. Like, the people, you couldn't stand on a corner and be lost for more than 3 seconds without someone coming up and saying, can I help you? So, yeah, they're great people.
Awesome answer. Hey.
I think as a pretty fair place, pretty fair nation, and, you know, low crime rate, I think a good place to be.
I think people like, certainly Canada, everywhere I've travelled a lot, and everywhere I go, people want to live in Canada. They all think we're very lucky to live here.
I describe it as a North American image, at least in the sense that in a lot of places you go, I don't think there's quite the distinction made between Americans and Canadians that a lot of Canadians like to think is made. I've had that experience. I tell people you're from Canada. In France, I remember being referred to as les Américains. They don't really make such fine distinctions necessarily.
I think people see us as friendly. Whenever I've traveled, I've always felt that that's how Canadians we're seen. We're seen as friendly, open, and accepting people.
I think in many cases we're seen as a irrelevant good guy. I mean, we don't participate in very much internationally. We don't spend very much money on international development. Not that I'm proposing we spend more. We don't have much of a military presence in the post-Afghan Afghanistan era, so we're pretty much irrelevant.
That's interesting. I was a big fan of Prime Minister Harper, and I think he, in terms of the world stage, I think he conducted himself really well. I think he represented Canada extremely well, and I'm hopeful that Trudeau will do the same thing, and then he gets some good advisors around him. So I think Canada has a very stellar reputation internationally, and hopefully we can maintain that.
I don't think people really care about us. If you want to know the truth, I think, you know, like we're a little dog in a big dog playground. We're the small one. We're the ones that are, you know, more of the people that will agree and will, you know, I don't think the people in the big whole of the world really care that much about what we do in Canada.
Well, I don't know. Trudeau seems to be putting on a lovely show these days. So, I don't know. I think we have a good image internationally. I think traditionally we have. And I think, you know, being a peacekeeping nation, which is what I think we should be, I don't think we should have went into Afghanistan.
I would say that it is going downhill fast because of our current governments at that level. I think we're trying to buy our way into favoritism rather than earn it. And as a result, I don't think we have the respect of the countries that we need the respect of.
Oh, I think it's okay. I think it's mixed. I think there's a lot more things that we can do. I think Canada needs to take a much stronger role in against Russia. Many people forget that we share a border with Russia, and there's a reason why we need to stand up to Putin, and Putin needs to get out of Ukraine. And we had an awesome Prime Minister who was fantastic in delivering that message. Right now, I'm not sure if we do.
I think it's a very positive image internationally already, but I think if we just keep being inclusive and positive, then we'll maintain that image.
I think we're the people that are often seen as those who say sorry a lot and a lot. We're also seen as a very neutral country in terms of politics and the environment. We're apparently somewhat better than most countries. I beg to differ, but I think overall we have a very positive image internationally.
I think we're good. I think things are. I think we're looked at as a fairly neutral country with some opinions in terms of the environment and human rights issues. I think we're a great place. I think we're viewed as a great place to be from and to be at. So I think Canada's viewed pretty well in the international environment.
I think we're pretty good. I know we say sorry a lot. I definitely say sorry too much. I've noticed that. But generally, from places I've been on vacation, they say Canada's like a good place. I think we're pretty great.
Canada is respected worldwide. Anywhere you go, where you come up with your passport or you're a Canadian, people look at you with respect, with dignity. I just came back from Africa, and all the airport that I passed through, there's a great respect for anyone that's in Canada, and
When was the Order of Canada established? 1947, 1957, or 1967?
67 was Confederation. Yeah. Okay, 67.
1967.
47?
I think it's 67.
1957. 67. 47?
1967.
I'd say 67 too. It sounds like a good centennial project.
1967. The Order of Canada is a brainchild of Lester B. Pearson and was established by Queen Elizabeth II in 1967. That's all for this episode of Outburst. Just a reminder, don't forget to check out our new CPAC TV To Go app and our CPAC Quiz Canada Trivia app. For more information, check our website, www.cpac.ca. I'm Glenn McGuinness, and on behalf of all my colleagues at the Cable Public Affairs Channel, thanks for watching. We'll see you next time.